Hello again, this is Dr. Jeff Zehr at Zehr Chiropractic. I wanted to talk to you today about a famous word in healthcare called arthritis. And talk about many misconceptions, misunderstandings about the term. I probably couldn't do it justice in just this one video. We might go on and do some more down the road, but I wanted to just give you some basic information, give you some things to think about. We do so much Googling today. I thought it would be a good idea just to Google arthritis. So I got the first two main results when I did that, outside of all of the ads. I think it was all ads except for two actual search results. And the Arthritis Foundation was the most common one. The Arthritis Foundation, when it came to just the word arthritis, described it as not well understood, and it's an informal way of referring to joint pain or disease. I found that a very interesting first statement by the Arthritis Foundation, given the way arthritis is understood and often talked about to patients by oftentimes their own general practice physician. Now, most of what I'm going to be talking about is about osteoarthritis. That's the type of arthritis most people think about. I'm not talking about metabolic diseases or autoimmune diseases, specifically OA or osteoarthritis, which is more the type you think about with when you get older or when you have an injured joint, those kind of things. I'll come back to that definition in just a minute. WebMD does talk about excessive stress with an implication only to an injured joint, though. I want to present to you a whole other way of looking at this thing called arthritis, because the problem that we see here at the office very often is people just assume they're all going to get it because they're older, that age is the only reason they have it, and there's nothing that can be done about it other than to take over-the-counter medications. NSAIDs is the acronym for that, non-steroidal anti-inflammatory drugs. They assume that's just their only thing they have to work with, and that's the part of it that I take issue with. First of all, the NSAIDs aren't even good for you. I think I might do a whole video just on that. They're not even good for you, but worse than that, besides their side effects and that, is the fact that they don't really address the cause of the problem. They're just trying to cover up the symptom more so than deal with the cause. And the overall issue and the takeaway that I want you to take away from today is there is something that can be done about arthritis, due to the fact that most of the time it is due to dysfunction in a joint. Dysfunction of which can be corrected through chiropractic care. Another thing we hear about so often is people come in and they say, I know I'm just riddled with arthritis. My doctor says I have arthritis and there's nothing that can be done. We see some of the ugliest spines. Let's talk about spines for the time being. We see some of the ugliest spines get well in that they function better and their symptoms often go away or are greatly minimized. No, we can't reverse arthritis per se. We can't make a arthritic spine on an x-ray suddenly look like a 20-year-old spine again. But again, the main thing I want you to understand is dysfunction in the joint often is what causes the arthritis. There's many ways I could demonstrate that. And again, maybe in coming videos, especially with x-rays that we take. That being said, as I speak about this, I'm thinking of more and more things that I can say. Just understand that we see people in here with arthritis every day. The vast majority of them we can have tremendous results with as far as their symptoms are concerned, and correcting what caused their arthritis in the first place, and therefore do it without drugs. So just understand that. Know there's other ways to deal with it than taking over-the-counter medications. Understand that you don't necessarily have to live with it for the rest of your life, and that it isn't just because you're getting older. Stay tuned for following videos on this where I can elaborate on some specific points from which I mentioned today. Have a great day, and we hope to see you and see if we can help you here at Zehr Chiropractic.